Hello and welcome to Coronavirus Catch Up. I'm Jordan Kenny. Welcome to the programme. We're live tonight on the BBC News NI website and Facebook page and on the BBC iPlayer for the next 25 minutes or so. Thanks for tuning in, however you're joining us. Well, as you can see, tonight we're live from the SSE Arena in Belfast, which is playing its role in fighting the pandemic as the home of Northern Ireland's mass COVID-19 vaccination centre. This arena has hosted the likes of Beyoncé, One Direction, Lady Gaga, Cher, some of the biggest pop stars in the world, but on Monday it opened its doors to the public who want a vaccine after being closed for almost a year. So just to paint a bit of a picture of what you can see here at the minute, this is where everyone is queuing ahead of getting their vaccine. There are 5 rows of cubicles in which you can receive your vaccine. Now the first 3 are operational at the minute. The 2 over my shoulder on this side have not yet been set up to administer vaccines. We're still in the first week of the centre opening, but once it's fully up and running, it's set to administer up to 40,000 vaccines per week. Now, to keep things COVID safe, we came in via the side entrance when we arrived earlier so that we were staying away from those who are here to get their vaccine. And we're quite high up as well above the arena floor so that we're not interfering with any of the important work going on down there. Tonight, I'm going to be putting your questions to Dr. Alan Stout, Chair of the Northern Ireland GPs Committee. But before that, I'm going to have a quick chat with our health reporter, Louise Cullen. Louise, you were here at the arena back in February when it was first announced that the SSE Arena was going to be home to Northern Ireland's first mass COVID-19 vaccination centre. Do you notice any difference from what it looked like back in February?
Just a smidge. When we were there in February to have a look at it, when we came in, the lights were turned on. It was pitch dark at first, and the lights were turned on. It took about 5 minutes for those lights to actually warm up and start to illuminate the arena. And you know yourself, anytime you've been there, you're cheek by jowl with everybody hustled in together, everybody dancing, shouting, yelling. The one thing that I was struck by was the remarkable silence and the space. It's actually a really huge space, and it's lovely to see it now filled up and being put to use. And there's been such a lot of work done in the last month to make this ready in terms of like cleaning and preparation and logistics layout. As you say, Jordan, you were coming in through the side door to try and create that, COVID safety barrier as well. And then you've got those 2 rows of cubicles behind you that aren't yet being used. And that's because things are just staggering, we're staggering the start of this to manage the supply of vaccine and also to allow a smooth handover between the Ulster Hospital, where people are getting their vaccination at the minute, to then the SSE Arena, which will be taking over, and they'll be running parallel for a little time as well.
Well, we've been hearing some great stories about what's going on here today. I even heard one saying that the dressing room, which the likes of, Beyoncé would have been using in times gone by, is now being used as the pharmacy to hold all the medication. So there's one fun fact about it. But before we go any further, let's take a quick look at the latest coronavirus figures for Northern Ireland from the Department of Health. No new deaths have been recorded from COVID-19 in the past 24 hours. The death toll remains at 2,115. A further 107 positive cases have been reported. That means there has now been 117,396 positive cases in Northern Ireland. There are 112 people being treated for the virus in hospitals here. 17 are in intensive care units. The R number, or reproductive number, this week is sitting between 0.9 and 1.05, rising slightly on last week. And on vaccines, 901,706 doses of a COVID vaccine have now been given out in Northern Ireland, and of that number, 756,013 are first doses. 145,753 people have had both their first and second jab of the vaccine. Now, as you can see behind me, the team are vaccinating people, and although, like I said, only half of the pods are in operation at the minute, or about half of the pods are in operation, the team will soon see almost 6,000 people passing through the arena floor per day. So that works out at about almost 500 vaccines being administered per hour. But to move on to restrictions, today Louise saw the easing of some restrictions. Up to 6 people from 2 households can meet in a private garden with social distancing being maintained. You can also meet for exercise outdoors in groups of up to 10 from 2 households, and golf is back as well as some other outdoor sports, and garden centres are now able to offer click and collect services. But the executive met today and have agreed to ease more restrictions. Louise, what's been happening?
Well, we know that now from the 12th of April, some of those garden centres that are now able to offer click and collect, well, they'll be able to open to the public, along with some other non-essential retail as well. All school pupils will be heading back to school on Monday the 12th of April. That's after the staggered start there in the run-up to the Easter holidays for some primary school pupils and some senior school pupils as well. Sport training, that can resume for non-affiliated clubs. That means people can get together for a kickabout. That's limited to 15 people, obviously outdoors still. And 10 people from 2 households can meet in a private garden as well. From that date, the stay-at-home message will be relaxed. But it's important to say that we're not out of the woods. This is not an opening up, shutters rolling up, free for all. We've seen the ONS statistics, that's the Office for National Statistics figures today. They run a rolling study of COVID-19 across the UK. Those figures, they are a little bit of a lag because they're based on figures in the week up to the 27th of March. But they're showing that in that week, infection incidence levels in Northern Ireland did actually appear to be increasing ever so slightly. Now, what we know from our dashboard here in Northern Ireland today is that our 7-day rate has now dropped below 50 for the first time in 6 months. A very little bit below 50. Now, that is very good news. But as I say, it's still very close to 50, and it's only the first time in 6 months. We still are taking things very cautiously. I've heard it likened to a hill start in a car with a handbrake, when you have to ride that balance between the clutch and the handbrake so that you don't roll forward too fast or roll backwards.
It takes me back to my days of learning how to drive. But to go back to the vaccines, Louise, we've had a couple of questions in about what vaccines are being offered where. This viewer says they had their first jab at the Ulster Hospital, which was Pfizer, but have now been told they will get their second jab here at the SSE Arena. She says she's worried she won't get the same one. What type of vaccine is being administered down here?
Well, it's important to say first that there are management systems in place throughout this entire programme. So if you have had your first dose of Pfizer, no matter whether it's in the Ulster Hospital or not, then you will be getting Pfizer again in the SSE Arena, because those second doses have all been cordoned off, if you like, for those people who are going to need them. The way this has been running, you can understand now that offering Pfizer through those vaccination centres, that was being offered to limited cohorts, different age groups, particular specific categories. That is now running down into the second doses, and they are getting beyond that second dose level. So what is going to happen, that vaccination centre at the Ulster Hospital is winding down slowly. Some of the staff that are working there are staffing those booths behind you there, Jordan, in the arena. And what's going to happen is that the 2 vaccines are going to be offered in the SSE Arena. There's going to be about a week overlap to cover those second dose Pfizer that will still be due at that point. But that's not expected to last terribly long. As I say, about a week overlap, and people then will be getting the AstraZeneca vaccine as well.
Well, Louise, we'll leave it at that. Thanks for joining us on the programme tonight. And just a reminder, if you're watching on Facebook, feel free to get involved in the comments section. If you have any thoughts or questions about what's being discussed on the programme, leave them there and we'll try our best to get to them before we're off air tonight. Now, also joining me is Dr. Alan Stout from the British Medical Association. Alan, thanks for joining us tonight. We're just going to get straight into the questions here. We're talking about vaccines tonight, obviously, but it's important to stress that even if you've had a COVID vaccine, whether it be 1 jab or 2 jabs, restrictions still apply, don't they?
Yeah, they absolutely do, Jordan, and that's a very important point. Even once you have your vaccine, it doesn't give you instant protection. So it's really important that anybody getting a vaccine knows that it will be about 2 weeks before it is fully working. You also know, and we know that with both vaccines that are being used at the moment, Louise has just referred to both of them, that both require a second dose, and that it's a second dose that will give you the maximum protection. But it's also vital, the vaccine is predominantly designed at protecting against serious illness. There's still a risk that even when you're vaccinated, you could still be transmitting infection, although the evidence is starting to show that you won't be transmitting it quite as much as we'd first feared. But you could also still be contaminated, so you could still actually carry the vaccine on your skin, on your hands, or wherever, and still be passing it on. So a simple answer to your question, absolutely vital that you still follow all of the restrictions.
Well, we mentioned earlier that more than 900,000 vaccines have now been given out in Northern Ireland. Those numbers are predominantly made up of people aged over 50, with 45 to 49-year-olds now eligible to get the jab as well. How important is it that as we move down the age groups, that younger people take up the opportunity to get the vaccine?
Yeah, that's very, very important as well. So just as the vaccine has been rolled out, as the programme has been rolled out, the absolute number one priority was to protect those that we knew were most at risk. So that is the older population, that is the people with other illnesses and chronic diseases and the clinically extremely vulnerable. But once we know that we're protecting those, the next stage of a vaccination programme is to try and reduce the population coverage and the population spread of the actual virus, stop the transmission. And the final stage, actually, of the vaccination programme is trying to eradicate the illness and the disease altogether. Now, we rarely get there with a vaccination programme, but with the younger people in particular, it is so important that we vaccinate them to try and reduce the transmission, try and reduce the spread. And that then helps with reducing the risk of variants as well, which is the one thing that will wreck all of the good work that has been going on so far.
Well, just to say, I can see we're getting some questions in on Facebook. I have my phone here, so I'm reading them. But just before we go to that, we're talking about social media, Facebook questions. I was listening to you, Alan, speaking on Good Morning Ulster earlier in the week, and you mentioned concerns about rumours that have been circulating on social media. How big of an issue do you think social media conspiracies and disinformation around the vaccine are in Northern Ireland?
It is a big issue. It's been a big issue right from the outset. I mean, it's not the first pandemic that we've had, but it's the first pandemic we've had in the era of social media. And we know that stories circulate. We know that fears and concerns and rumours and myths circulate very, very quickly on social media. And it is really, really important that we try and get beyond those and that we try and debunk a lot of those myths, because it's very, very easy for those to get traction. And that is our big fear. Again, you'd referenced the figures so far. And because we've targeted the older and the at-risk age groups, the uptake of the vaccine has actually been phenomenal. It's exceeded, I think, any of our expectations, and by and large, just about everybody is getting it. But I think there is a definite recognition that as we start to move into the younger age groups, those are the ones that can be influenced by any number of things, social media being one of them. We have a bit of complacency. We have, as things open up, people become busy and they are doing other things and they become preoccupied and they might just not go for the vaccine. So we do know that it is just going to be more challenging for quite a number of reasons to capture and to get a really good vaccination rate in that group.
Well, just talking about the importance of taking up the offer of a vaccine, Paul has got in touch and he's asking, as a 22-year-old male with no underlying problems or caring responsibilities, when can he reasonably expect to be called for his vaccine? And I suppose I'm pretty interested in this answer as well. I'm 22. So when can people like me and Paul expect to be called for our vaccine?
Yeah, so we've targeted mid-May as the time that everybody who is eligible, so that will, at the moment, that is everybody who's over 18 years old, because that's where it's licensed or what it's licensed for, will have got the first dose. So you're kind of at the younger age, and as we go through the age cohorts, you'll probably both be in the last cohort to be called, with no other illnesses or no other risk factors. So I would be thinking late April, early May would be the most likely option.
We've Christine Armstrong getting in touch on Facebook. She's saying she wants the static caravan sites open. She says caravan owners have their own amenities and can social distance. It's no different staying at home or in our static caravans. There's a lot of people want to get out and are chomping at the bit to get back to normality, I suppose, especially coming into the summer months.
Yeah, and we all do. And today was a big day. I think Louise referred to it in her introduction. That some things have opened. Static caravans is actually quite a good example, because What we will see, and I think even the announcement today of further openings in the next couple of weeks, very much focusing on outdoor activities and things, everything being in the fresh air. We know that is much, much less risk than enclosed spaces. So I think, examples like static caravans, sporting activities outside, exercise outside, meeting family and friends outside, those are the things that we will see most of all. And when we think of hospitality as well, and I think we all feel sorry for hospitality. Hospitality has been hit extremely hard, but we know that they, even through the last lockdown, had put in so much work and so many measures on outdoor spaces and so on, and that's going to suit and to put them in a very good position as we do open up.
Well, Brenda has been in touch. She's asking if there could be any expectation that the time between the first and second doses could be reduced, given the opening of the mass vaccination centre here and the increased rollout of the vaccine.
Yeah, that's a good question, an important question. And again, it comes down to the two different vaccines. And this is learning as we go. So in the early stages, we knew that the license was for a shorter interval, and the 4 chief medical officers across the UK made at that time what was quite a courageous decision to extend the interval. And actually, as time has passed, it has been shown that was probably the correct decision, because it meant that more people would get their first dose quicker, so we would be protecting more people as quickly as we possibly could. Now, what the evidence now shows, particularly for the AstraZeneca vaccine, which is the one that most people are getting at the moment, most people being vaccinated at the moment, the evidence is actually strongest for the second dose to be at 10 to 12 weeks. So it would actually be counterproductive now to bring the second dose of that forward, because you will get better protection by waiting that period of time to actually get the second dose.
Well, I see Fiona's in touch on Facebook. She's asking about the AstraZeneca vaccine. We'll come on to that just shortly, but let's see. Right, this one is from Johnny. He's asking, how come after months of lockdown and with so many people now vaccinated, there are still a lot of positive cases each day?
Yeah, very simple answer to that. That is just contacts, and it is just transmission. What we know, and I think if you ask anybody, the last few weeks in particular haven't really looked like we've been in lockdown. It's certainly vastly different to this time last year when we went into the first lockdown, where people really did stop leaving their house and stop mixing, with far, far more mixing than we had before, and hence the virus is still spreading. We know, even though the numbers are coming down, we know that we're slightly below, but close to 1,000 infections a week. So it is still there, and it does not take an awful lot more contacts for that to start to jump again. And that is the fear at the moment. That's why we need to be so cautious and so measured as we do start to open up, and as we know that contacts will start to increase. Because I think the last thing that any of us want is another spike, another problem, and the risk of another lockdown. We want this to absolutely to be the last one.
Well, I'm just looking at some of our other questions that are coming in. Maura's got in touch. She says, when can I ever hug my 3-year-old grandson? I can now meet him outside, but he will want to hug me. I suppose she's talking about the new restrictions there. It is difficult for people, isn't it?
It is difficult, yeah. And I mean, of course, we've got every sympathy with everybody who's in that position. I think that day is coming very, very soon. I think we just need to be cautious, and we want to minimise risk. Again, with young children and the older population, we've got to be careful. Schools, nurseries and so on, the risk of spread. We already know with schools going back that there have been incidents in schools, infections in schools and so on. So the risk is still there. It is just, patience. I've never used the word patience more in my life, but we just need to be patient and need to make sure that we properly get out of this and we minimise the risk to everybody.
Well, Maura was referring to it there in her question. We mentioned it with Louise as well. The fact that some restrictions have been eased in Northern Ireland today, and obviously we heard about the executive agreeing more easements to the restrictions as well. But we've been told time and time again by the executive that our exit from lockdown will be slow and cautious. The executive's meeting again on the 15th of April to review the restrictions that are in place. But looking even to England, in 11 days' time, outdoor pubs and restaurants will be reopening, along with non-essential retail, hairdressers, and there'll be other easements in other sectors as well. But Alan, who's taking the right approach here? We seem to be going a lot slower.
I don't know that we're going a lot slower. I think we're going slightly differently. And what we're doing is we're putting confidence in the tracking and in the data that we're getting. So as each step that we take, so with schools opening a couple of weeks ago, for some pupils, for a number of other things, including outdoor activities and meeting in gardens and so on, opening again today, what we need to do is then just see what happens to the figures, so the infection numbers, the hospitalizations, intensive care deaths over the next 2 or 3 weeks, and really judge it on there. And what we can then do is be relatively flexible in terms of what we do. So as we grow that confidence that we're not getting more infections and more problems as a result of the infections, we can make properly informed decisions. And I think when you speak to anybody, certainly at a senior level here, it's actually slightly frightening what is happening in England, because they now have these target dates, and we know that restaurants are full on those dates, and we know that they're talking about stadiums and they're already selling tickets and so on and such like, and that's just a recipe to disappoint people and to let people down. I think we're much better doing it in our measured way here. I know people are frustrated by the dates, but making sure that we give people enough notice, and particularly in the different sectors, enough notice that they are going to be able to open up, but really have that confidence that we're continuing to go in the right direction, we're continuing to control the infection, and that we're not putting anybody at risk.
Well, obviously the executive are meeting again, like I said, on the 15th of April to review the restrictions that are in place. Have you any, what would you like to see them agree? Do you think we could go as far as, agreeing dates for opening pubs and restaurants and parts of the hospitality sector, for example?
Well, I would love to say yes, but we have 2 weeks between now and then, and those 2 weeks are critical for the reasons that I've just said. I mean, we will get so much information and we will get so much data in those 2 weeks. I don't think for a second that they're going to rush things, that they're suddenly going to open a lot of things at once, because I think that would be a mistake. I think we'll continue to see a gradual and a staggered reopening with 2 to 3 week intervals between, each stage. And we've already seen their roadmap, and the plan for that. So they will undoubtedly follow that very, very closely, but whilst tracking those infection numbers and the data.
Well, we've had a question in here from Beverly. She says, Fiona mentioned the AstraZeneca vaccine on Facebook slightly earlier, so this ties into that. She says she had her first dose of the AstraZeneca vaccine, but is concerned about getting the second dose due to the suspension of it by some countries. She's asking for your advice. What do you say to her?
I would say make sure you do get the second dose. It is really, really important that we are vaccinating as many people as we possibly can. We are very reliant on our experts. We're very reliant on our regulators, and we know that our regulators will not take any chances, will not take any risks. There are various countries in Europe that have, and some of the announcements and some of the news stories we know have an impact here, an impact on people's thinking. But we also know that the European regulator, the UK regulator, MHRA, and we know that the WHO, the World Health Organization, are tracking the vaccine, tracking the side effects, tracking the complications better and closer than they've ever tracked any other vaccine, in fact, even any other medicine or product, because this is such a big issue, such a big world program for vaccination. So we are massively reassured with what we're hearing from all of the regulators, and I think everybody should be reassured by that. Particularly on the blood clot issue, there is not a single regulator has yet shown that there is any direct link between the vaccine and the blood clots.
Well, finally, Alan, looking ahead to the Easter weekend, obviously round the corner, what's your advice to people who might think it's time to forget about the restrictions?
Well, it's not time to forget about the restrictions. Absolutely, definitely not. This is a really, really critical time. We are on a tightrope. Things could still go both ways. Everything is going the right way at the moment, and we cannot jeopardize that. We cannot wreck it for the sake of everybody, for the sake of everybody's health, for the sake of the businesses, for the hospitality, and for everybody else that has struggled and suffered and committed, through the lockdown. So for the sake of a few days over Easter, for the sake of the next few weeks, please follow the restrictions, follow the guidelines, and it means that we will get a sustainable, a safe, and a long-term way out of this.
Well, Alan, unfortunately, that's all we have time for this week, so we'll have to leave it at that. But thanks again to both Louise Cullen, our health reporter, and Dr. Alan Stout for coming on and answering those questions. And thanks as well to the Southeastern Trust and the SSE Arena for allowing us to come here tonight. I've been here for most of the day, and it's been a constant stream of people. It's starting to get a bit quieter now, but it's been a constant stream of people through these doors here to get their vaccine. It's been very impressive and, gives us all hope for brighter days ahead. I think the final appointment for vaccines is at 10 to 8, so just not too far away. But that's it from us here. Don't forget you can keep up to date with all the latest developments on the BBC News NI website, which you'll find at bbc.co.uk/newsni. And we're on social media as well. If you've been watching on our Facebook or YouTube pages, you'll have already found us on there. But we're on Twitter, Instagram, YouTube and Facebook. That's the 4 of them. So just type in BBC News NI when you're on there and you should find us. We'll be back with another coronavirus catch-up again at the same time next Thursday night, when we'll be answering your questions again on restrictions ahead of changes coming in on the 12th of April like we've been hearing about. But that's it from us here at the SSE Arena tonight. Thanks for tuning in. We'll be back again next week. Talk to you then. Stay safe.